Good day, conference participants. It's an honor to speak to you about Compassionate Kazakhstan as the Senior Advocacy and Partnerships Director for the International Association for Hospice and Palliative Care, a non-state actor in official relations with the World Health Organization and a civil society organization in consultative status with the UN Economic and Social Council. I'll begin by briefly listing the laws and resolutions that Kazakhstan has committed to that authorize universal provision of palliative care for those in need in your country. So Kazakhstan is part of the family of nations and participates in what's called the multilateral, that means many countries, normative framework of international laws and resolutions agreed upon by the representatives of all nations. Your government has approved the World Health Assembly Resolution 6719 on palliative care in 2014, the United Nations Outcome Document from the General Assembly on the World Drug Problem of 2016, the Declaration of Astana on primary health care in 2018, the Political Declaration on Universal Health Coverage in 2021 and 2023, the Political Declaration on Non-Communicable Diseases is coming up in 2025, and I'll talk about that in a minute, but there's also earlier ones. The Pandemic Treaty that was adopted by the World Health Organization, World Health Assembly in 2025, so this May, and the Human Rights Council resolution on older persons, which also mandates palliative care provision. So these commit Kazakhstan to develop palliative care as part of primary health care under universal health coverage. Implementing all these resolutions, which call for palliative care, is a multi-year evolutionary process that requires political will based on clear understanding of how palliative care can benefit the country as a whole. There's evidence of the economic benefits to the health system and to households already, so that is something we already know. The crown jewel of the multilateral agreements Kazakhstan has signed is the UN 2030 Agenda for Sustainable Development Goal 3, which is good health, and Target 3.8, which calls for universal health coverage. And universal health coverage now includes palliative care along with disease prevention, health promotion, treatment, curative care, and rehabilitation. So all that spectrum of health services under universal health coverage includes palliative care. And the IAHPC, my organization, concentrates on advocating for and helping countries educate their workforces, their doctors, nurses, pharmacists, social workers, spiritual care advisors in palliative care. And this complex diagram of palliative care development in Kazakhstan appears in the 2025 Atlas of Palliative Care in Europe, which you can study at your leisure. And it shows how much progress you've already made in the last decade in terms of service development, education, use of essential medicines, among other things. So congratulations on all the hard work that's brought you this far. It's only with partnerships between civil society organizations such as the Palliative Care Association of Kazakhstan and government officials, so partnerships between civil society and government, that palliative care can develop so that it meets the needs of all Kazakhstan's seriously ill citizens. And education of the workforce and for health is key to further development. Essential generic medicines such as oral morphine must be available and affordable, and clinicians must be taught to prescribe them safely to relieve physical suffering so that they're not diverted into the illicit market. And there are plenty of guidelines available now so that member states can assure that that doesn't happen. A rise in opioid availability for medical patients does not mean that it has to be an opioid epidemic. There are many ways to prevent that, and the WHO guidance has that information. So my organization, the IAHPC, puts a lot of staff time and funds into education because it's now well documented that education is a key driver to make palliative care available to all with palliative care needs. And our members can take online courses that are taught by experts in palliative care basics. They can learn about neurological conditions, pain management, cancer symptom management, and advocacy. We also offer scholarships for educational events such as this National Congress. We engage in collaborative global research to produce evidence-based documents your health workforce can use, such as the Essential Palliative Care Package on the left and the guidance on the use of essential medicines, all of which can be found on our website and translated through the artificial intelligence on your device. So our programs support the capacity of interdisciplinary teams that relieve the total suffering of seriously ill and dying people and their families who experience pain and spiritual distress, as well as psychological and existential distress, because all of these can afflict a household. And these teams, these palliative care teams who are properly educated, can help the survivors and family caregivers of dying patients recover from the trauma of accompanying a loved one at home and experience bereavement after they die. International evidence shows that investment in interdisciplinary teams not only relieves suffering and supports families, but it also reduces costly hospitalizations and strengthens health systems as a whole. So there are many, many benefits, as I said earlier, to having palliative care at the household level and at the health system level. And finally, just to wrap up, the United Nations is now considering this political declaration on non-communicable diseases, which will be adopted by the General Assembly. And this year, for the first time, palliative care has its own standalone paragraph. It's not just part of a list of other services. Paragraph 58 actually says, develop, strengthen, and implement, where possible, palliative care policies, which I know Kazakhstan already has, to support the comprehensive strengthening of health systems to integrate evidence-based, cost-effective, equitable, that means for everybody, and accessible palliative care services in the continuum of care across all levels, with emphasis on primary care, community and home-based care, and universal health coverage schemes. So it's important that Kazakhstan supports this resolution and shows the Central Asian countries as well as those in the WHO European region, that it's a leader in promoting compassion without borders. So congratulations again on this historic conference. IAHPC will always be here to support you, so please feel free to join us. I had a wonderful time when I came to your beautiful country for the Astana conference in 2016, and palliative care was adopted into the text, which took a lot of hard advocacy work. So in a sense, Kazakhstan is the birthplace of palliative care as an essential part of primary care. So you're leading the way for Europe and the world. Have a wonderful conference, and congratulations again.